I'll introduce myself. I'm the one moving the slides here. So my name is William Baur, and I am a middle school science teacher in Battleground, Washington. And boy, does Battleground live up to its name, let me tell you. We probably all feel like we're living in battlegrounds right now. And in addition to being a teacher, I'm also a unpaid farmhand at my family's uh, farm called Bowers Corner Farm in Ridgefield, Washington. Uh, and so come with me on a journey down a rabbit hole, the public health data rabbit hole. So join me, okay? This is the sequel to Alice in Wonderland, nobody wanted or asked for. So I had a simple request. How many students and staff have been in schools with COVID-19 so far, just in Washington? How many people did they expose? So a little bit of backstory. So um, for me, like checking the public health data websites has been sort of a routine going back to 2019 when my school was part of a measles epidemic. And 25% of my uh, students were unvaccinated by choice, and our school shut down remotely 3 school years ago. So it's my third year in a row teaching in epidemic pandemic. So I know where the public health data sits in Clark County, and they do a good job collecting the data. But in early December, Clark County Public Health erased this data from their website and only published cases of transmission before they told you how many students, how many staff had COVID in the schools and at what dates. And then it just so happened like a week later, Governor Inslee changed his definition of what was safe from 75 per 100,000 to start looking at open up schools to in-person learning to 350, with the stroke of a pen. And so that got me motivated. So down the rabbit hole I went, and over my winter break, I submitted over 25 public records requests to county health departments, state Department of Health, OSPI, with the same request language. Um, uh, one, data on all COVID-19 exposures this school year, and two, the number of close contacts they may have had that would need to quarantine. I thought this was a pretty simple thing to know, and that they must have this data to make these changes in safety. They must know how exposed teachers and staff have been and will be this year. So here's what I found. This is a little screenshot. So this is from Washington State Department of Health. Start at the top of the bureaucracy. They have no records responsive to my request. Okay, so the same agency that's made this decision, like one to increase the threshold of what's safe, and then also to move the vaccine schedule so that younger teachers like myself, yes, I still qualify as a younger teacher, we're going to get our vaccine in April maybe, and there's no record of how much COVID-19 is in our schools. How can they possibly make that decision? Our public health leaders at the state level. Another thing that's kind of happened is that public health departments are shifting the responsibility of tracking this pandemic onto the schools. So they're asking OSBI to tell us about a pandemic, not a public health department. So it's at the state level, but it's also at your local level. And the reason why they've done that is because the level of transmission of COVID-19 has overwhelmed their health departments. So then why are we going back? So let's go to OSPI. Chris Reckdahl stood, arm in arm with, digitally, I guess, with Chris Reckdahl, who wants to open up schools ASAP. So do they know how many COVID-19 cases are in schools? No. They say go contact each individual school. So no state agency is compiling any of this information, but then they're making state decisions that impact the safety of everyone in our state. So in the chat, you could really do us all a favor to we have so many people all over the state here. So in the chat, if you could put the name of your school district, and if you know if they publicize any COVID-19 data in schools. So, and then bonus points if you can paste the URL in there to see how of the website, so that we can look and see, like, how does your school, how does your county stack up to others? Are they all sharing the same data or different data? So drop that in the chat, and we'll save the chat, and we'll kind of see like how inconsistent they are in terms of collecting this data, and they're not even compiling it. You don't count what you don't care about, which is sad that that's the case. So I went into the county level, and this is just a summary table. I'm still waiting back to hear from many of them. So I put King County there, our most populous county. They said no data, 6 to 8 week wait on your request. So I still don't have any information about what's happened in King County. I'll just go down this kind of my 5 main questions, and you can kind of read it for yourself, and then I'll talk about some patterns that I've noticed. So is the county keeping count of exposures? So I define an exposure as like how many students and staff are taking COVID into schools. Okay, so of this sampling of across the state, only 3 are keeping track of the 5. And then is the data available on a county public health website? Only Yakima of this list. Clark County used to have it, and then their removal of it motivated my quest down the rabbit hole of public records requests. Then third question, how many cases of proven transmission at school sites K-12? So look at these numbers. Do these look like they correlate at all with the level of virus in the community? No. Or do they correlate at all with the level of reopening that's occurring in these communities? No, but they should. The problem here is data collection. The county that had experienced a pandemic of measles the previous year is doing the best job because they have trained contact tracers, trained with experiences. So when you think about how our country has handled the pandemic and compare it to Asian countries who have gone through SARS and MERS and bird flu and everything else, like they know how to handle a pandemic. And so Clark County, even though they removed their data, they're at least doing a good job tracking transmission, though we know without any testing and so many asymptomatic cases, this is very underreported. And then the number of staff and students, the fourth question, number of staff and students that have brought COVID into schools. Okay, so some counties aren't even keeping track of that. And again, no correlation with what the disease amount is in the community when there should be a correlation. That would make sense. There is, but it's just not getting tracked or counted. And then the fifth question is, how many close contacts did these individuals have? So this is a really important number. This is, I think, is the most important number when looking at what's the level of disruption COVID-19 is going to have on reopenings. If you can see that like one teacher goes into the classroom, picks up science supplies, and then leaves, okay, and exposes no one, okay, that's one thing. But if it's an elementary music specialist who is having exposure with 100 kids in a day, that's going to be a lot of close contacts. That's a lot of people who have to quarantine. And if your county or your schools aren't publicizing the number of close contacts, you have no idea of how many times schools have had to shut down and go back in person. So that is a vital number that we need to have to make important decisions about what our reopening has been like or what it's going to be like. So the so here's some initial conclusions on very poor quality data. If this data set was given to me from a student, they'd probably get like a D-. That's being generous, okay? That's like some COVID grading scale, like we don't want to fail you, D-. Asymptomatic spreading among adults and school settings is underreported, and each county and school is doing it differently, and none of the data is being compiled. So number 2, the count of staff and students in schools with COVID-19 and the quarantine numbers of close contacts is important to understand the level of transmission COVID-19 has on in-person learning. In my preliminary data, it looks like the number of staff and students that bring COVID in to schools quadruples the amount of people that have to quarantine and go back and be isolated or test or potentially expose their family members at home. And this like three to 4 times, like that's a huge range. Like it could have been 100 or it could have been 0. So I think like the key question that comes out of all of this with this really incomplete data, how can parents get a sense reasonably of how safe it is to send their kids to school when they have no idea how much COVID is in the school, and that if it's getting kept track at all, it might be secret from them. And this is important for teachers as well, because it's the parent's choice, an uninformed choice, that is going to determine staffing in most districts, and how many of our teachers are going to be forced into work in unsafe conditions before their vaccine arrives. So thank you for joining me in this journey down the rabbit hole of public records requests. But was it worth it? Yes. Okay, what did it bring me? It brought me greater transparency. My district started to report their exposure data on their website. They still don't have the amount of people who were close contacts, but it's a step in the right direction. The media specialist for my district knows that I made 25 public records requests, and that she found that out on Friday, and on Monday they published it on their website. But not all school districts in my county have done that. It used to be on the public health website, one spot. Now it's some districts have it, some districts don't. But without this advocacy, it would be hidden still. And then parents, who have to decide whether assess the risk for their children, they don't have the data to make that decision. So it's brought me access. Tacoma Pierce County Public Health, where I used to teach in Tacoma, they felt so bad that they didn't have any data to give me, that they just gave me the phone number, direct line to Dr. Cam Solomon, the chief epidemiologist. And then I got to ask him any question I had. And let me tell you, like, having that access is important, because it kind of gave me indication early on that the county health departments and the State Department of Health, they're not united in this vaccine rollout or this level of this 75 versus 350 per 100,000 number. Okay, but being public employees, they might not be able to speak out. I can run my mouth a little bit more because I've got a strong union, but people who are in county health departments don't have the same that same ability. And it's also brought me media attention. Just before this call, I was on the phone with a reporter for the Seattle Times for 40 minutes, and there should be a story probably Tuesday or Wednesday of next week about the work I've been doing. So so that's kind of the end of this part of my presentation.